Pneumonia is a medical condition that causes inflammation of the lung tissue, making it difficult for the lungs to function properly. The inflammation can be caused by bacteria, viruses, or other pathogens, as well as non-infectious factors such as chemical irritants or trauma. Pneumonia can range in severity from mild to life-threatening. There are several types of pneumonia include bacterial pneumonia, viral pneumonia, fungal pneumonia, aspiration pneumonia, community-acquired pneumonia, hospital-acquired pneumonia, ventilator-associated pneumonia. Bacterial pneumonia is a type of lung infection caused by bacteria that invade the lung tissue, leading to inflammation and a buildup of fluid in the air sacs. It is one of the most common types of pneumonia, and can be caused by several different types of bacteria, including Streptococcus pneumoniae, Haemophilus influenza, Legionella pneumophila, and others. Bacterial pneumonia can occur in people of any age, but it is more common in older adults, young children, and people with weakened immune systems. The symptoms of bacterial pneumonia can include cough, fever, chest pain, shortness of breath, fatigue, and muscle aches. The severity of symptoms can vary depending on the age and overall health of the person affected, as well as the type of bacteria causing the infection. Treatment for bacterial pneumonia usually involves a course of antibiotics, which are prescribed based on the specific type of bacteria causing the infection. In severe cases, hospitalization may be necessary, and oxygen therapy or mechanical ventilation may be needed to support breathing. It is important to seek prompt medical attention if you or someone you know develops symptoms of pneumonia, as early treatment can help prevent complications and improve outcomes. Viral pneumonia is a type of lung infection caused by a virus, such as influenza, respiratory syncytial virus, RSV, adenovirus, or other respiratory viruses. Viral pneumonia is less common than bacterial pneumonia but can be equally severe, particularly in people with weakened immune systems, older adults, and young children. The symptoms of viral pneumonia can be similar to those of bacterial pneumonia, including cough, fever, chest pain, shortness of breath, fatigue, and muscle aches. However, viral pneumonia may also cause symptoms such as sore throat, runny nose, and headache. Treatment for viral pneumonia depends on the specific virus causing the infection. In some cases, antiviral medications may be used to help reduce the severity and duration of symptoms. However, for most viral infections, supportive care such as rest, hydration, and fever-reducing medications is the mainstay of treatment. Fungal pneumonia is a type of lung infection caused by a fungal organism, such as Pneumocystis jirovecii, Aspergillus, or Cryptococcus. It is most common in people with weakened immune systems, such as those with HIV/AIDS, cancer, or taking immunosuppressive medications. Fungal pneumonia can cause a range of symptoms, including cough, fever, chest pain, shortness of breath, fatigue, and muscle aches. In some cases, fungal pneumonia may be asymptomatic. Diagnosis of fungal pneumonia usually involves a combination of imaging studies, such as chest X-rays or CT scans, and laboratory tests, such as blood cultures or bronchoscopy, to identify the specific type of fungus causing the infection. Treatment for fungal pneumonia depends on the specific organism causing the infection. Antifungal medications, such as fluconazole or amphotericin B, are commonly used to treat fungal pneumonia. In severe cases, hospitalization may be necessary, and oxygen therapy or mechanical ventilation may be needed to support breathing. Prevention measures for fungal pneumonia include maintaining good hygiene, avoiding exposure to environmental fungi, and taking appropriate precautions to prevent the spread of infections in healthcare settings. In people with weakened immune systems, antifungal prophylaxis may be recommended to prevent the development of fungal infections. Aspiration pneumonia is a type of lung infection that occurs when food, drink, or other substances are inhaled into the lungs, leading to inflammation and infection. It is most common in people with conditions that affect swallowing, such as stroke, Parkinson's disease, or dementia, and in people with reduced consciousness due to alcohol or drug use, anesthesia, or seizures. The symptoms of aspiration pneumonia can include cough, fever, chest pain, shortness of breath, and difficulty breathing or swallowing. In some cases, aspiration pneumonia may also cause symptoms such as confusion, fatigue, and decreased appetite. Diagnosis of aspiration pneumonia usually involves a combination of imaging studies, such as chest X-rays or CT scans, and laboratory tests, such as sputum cultures, to identify the type of bacteria causing the infection. Treatment for aspiration pneumonia typically involves antibiotics to treat the bacterial infection, as well as supportive care such as oxygen therapy and bronchodilators to help relieve symptoms. In severe cases, hospitalization may be necessary, and mechanical ventilation may be needed to support breathing. Prevention measures for aspiration pneumonia include addressing underlying conditions that affect swallowing, such as treating stroke or Parkinson's disease, avoiding excessive alcohol or drug use, and taking steps to reduce the risk of aspiration during medical procedures or surgery. Community-acquired pneumonia, CAP, is a type of pneumonia that is acquired outside of a hospital or healthcare setting, typically in the community or at home. It is caused by a variety of infectious agents, including bacteria, viruses, and fungi. CAP can affect people of all ages, but it is most common in young children and older adults, as well as people with underlying health conditions or weakened immune systems. The symptoms of CAP can include cough, fever, chest pain, shortness of breath, fatigue, and muscle aches. Diagnosis of CAP usually involves a combination of imaging studies, such as chest X-rays or CT scans, and laboratory tests, such as sputum cultures or blood tests, to identify the specific type of pathogen causing the infection. Treatment for CAP depends on the type of pathogen causing the infection. Bacterial pneumonia is typically treated with antibiotics, while viral pneumonia is treated with supportive care such as rest and hydration. In severe cases, hospitalization may be necessary, particularly for people with underlying health conditions or who are at high risk of complications. Prevention measures for CAP include vaccination against certain pathogens, such as influenza and pneumococcus, as well as practicing good hygiene, such as washing hands regularly and avoiding close contact with people who are sick. Hospital-acquired pneumonia, HAP, is a type of pneumonia that occurs in people who are hospitalized for another condition. HAP is typically caused by bacteria or other pathogens that are present in healthcare settings, such as hospitals, long-term care facilities, or rehabilitation centers. HAP can affect people of all ages, but it is most common in older adults, people with underlying health conditions or weakened immune systems, and people who are on mechanical ventilation or have a breathing tube inserted. The symptoms of HAP can be similar to those of community-acquired pneumonia, including cough, fever, chest pain, shortness of breath, fatigue, and muscle aches. Diagnosis of HAP usually involves a combination of imaging studies, such as chest X-rays or CT scans, and laboratory tests, such as sputum cultures or blood tests, to identify the specific type of pathogen causing the infection. Treatment for HAP typically involves antibiotics, as well as supportive care such as oxygen therapy and mechanical ventilation to support breathing. In severe cases, hospitalization may be necessary, and the length of hospital stay may depend on the severity of the infection and the person's overall health status. Prevention measures for HAP include implementing infection control measures in healthcare settings, such as hand hygiene, environmental cleaning, and appropriate use of antibiotics. Other prevention measures may include early mobilization, removing breathing tubes or other invasive devices as soon as possible, and avoiding unnecessary hospitalizations. Ventilator-associated pneumonia, VAP, is a type of pneumonia that develops in people who are on mechanical ventilation for an extended period of time. VAP is caused by bacteria or other pathogens that enter the lungs through the breathing tube or ventilator. VAP is more common in people who are hospitalized in intensive care units, as they are more likely to require mechanical ventilation and are more susceptible to infections due to weakened immune systems and underlying health conditions. The symptoms of VAP can be similar to those of other types of pneumonia, including cough, fever, chest pain, shortness of breath, and fatigue. However, people with VAP may also have additional symptoms such as increased secretions or difficulty clearing secretions. Diagnosis of VAP usually involves a combination of imaging studies, such as chest X-rays or CT scans, and laboratory tests, such as sputum cultures or blood tests, to identify the specific type of pathogen causing the infection. Treatment for VAP typically involves antibiotics, as well as supportive care such as oxygen therapy and mechanical ventilation to support breathing. In some cases, the breathing tube may need to be replaced or removed to improve respiratory function. Prevention measures for VAP include implementing infection control measures in healthcare settings, such as hand hygiene, environmental cleaning, and appropriate use of antibiotics. Other prevention measures may include using oral care protocols to reduce the risk of oral and respiratory tract colonization, as well as implementing strategies to reduce the duration of mechanical ventilation. The symptoms of pneumonia can vary depending on the type of pneumonia, the severity of the infection, and the individual's age and overall health. However, some common symptoms of pneumonia include cough, which may produce phlegm or mucus, shortness of breath or difficulty breathing, chest pain, which may worsen with coughing or deep breathing, fever, sweating, and chills, fatigue and weakness, muscle aches and joint pain, headache, confusion or delirium, especially in older adults. Pneumonia can be caused by a variety of infectious agents, including bacteria. Bacterial pneumonia is a common cause of pneumonia, and it can be caused by various types of bacteria, such as Streptococcus pneumoniae, Haemophilus influenza, Legionella pneumophila, and Mycoplasma pneumoniae. Viruses. Viral pneumonia is another common cause of pneumonia, and it is typically caused by respiratory viruses such as influenza virus, respiratory syncytial virus, RSV, and adenovirus. Fungi. Fungal pneumonia is less common than bacterial or viral pneumonia, but it can be caused by various types of fungi, such as Histoplasma capsulatum, Cryptococcus neoformans, and Pneumocystis jirovecii. Aspiration. Aspiration pneumonia is caused by inhaling food, liquids, or other substances into the lungs. This type of pneumonia is more common in people who have difficulty swallowing or who have impaired consciousness, such as people with a neurological disorder or who have had a stroke. Chemicals. Inhalation of certain chemicals or toxic fumes can also cause pneumonia. Other less common causes of pneumonia include parasites, certain medications, and autoimmune diseases. There are several preventive measures that can help reduce the risk of getting pneumonia. Vaccines. Vaccines are available to prevent certain types of pneumonia, including pneumococcal vaccine, which protects against Streptococcus pneumoniae, and influenza vaccine, which protects against the flu. Hand hygiene. Practicing good hand hygiene, such as washing hands regularly with soap and water or using hand sanitizer, can help reduce the risk of respiratory infections. Avoiding exposure to smoke and pollutants. Avoiding exposure to cigarette smoke, air pollution, and other environmental pollutants can help reduce the risk of respiratory infections. Maintaining a healthy lifestyle, eating a healthy diet, getting regular exercise, and getting enough rest can help support a healthy immune system and reduce the risk of infections. Managing chronic health conditions. Managing chronic health conditions, such as diabetes, heart disease, and COPD, can help reduce the risk of respiratory infections. Getting prompt treatment for respiratory infections. If you develop symptoms of the respiratory infection, such as a cold or the flu, seek prompt medical attention and follow your healthcare provider's advice for treatment and management. The treatment for pneumonia depends on the underlying cause of the infection and the severity of the illness. In general, treatment may include antibiotics. If the pneumonia is caused by bacteria, antibiotics may be prescribed to help clear the infection. It is important to take the full course of antibiotics as prescribed, even if you start feeling better, to ensure that the infection is fully treated. Antivirals. If the pneumonia is caused by a viral infection, antiviral medication may be prescribed. Oxygen therapy. For severe cases of pneumonia or for individuals with difficulty breathing, oxygen therapy may be necessary. Fluids. Drinking plenty of fluids, such as water and broth, can help prevent dehydration and loosen mucus in the lungs. Rest. Getting plenty of rest is important for the body to fight off the infection and recover. Over-the-counter medications. Over-the-counter pain relievers, such as acetaminophen or ibuprofen, can help relieve fever and discomfort associated with pneumonia. Hospitalization. In some cases, hospitalization may be necessary for individuals with severe pneumonia, complications or other underlying health issues.